Good morning, everybody. Welcome to another edition of talks from Apollo Spectra. This is Dr. Ramachandran here, cosmetic surgeon, and today we are going to talk about liposuction and what it actually means to the general public. The word liposuction is very commonly used, and very simply put, it means sucking out fat. Lipo is fat, and suction obviously means suctioning. So this actually, as a concept, evolved around 100 years back. You'll be surprised that we are now familiar only for the past 30 to 40 years, but this actually was addressed about 100 years back using very sharp instruments with an attempt to curate out any fatty deposit. But it did not meet much success and more or less was abandoned for about 50 to 60 years. It was only in the 70s that there was a resurgence in an attempt to remove fat, and so people were trying to find out different methods by which fat could be removed from the body without making big cuts, because the initial procedure used to be called lipectomy, where skin and fat used to be removed, but it used to result in long incisions. So the surgeons were always trying to find out how we could attempt removing fat through very small incisions like a keyhole. And it was around 75 to 80, 1975 to 80, that this became established, and it was popularized by a French surgeon by name Illouz. And his technique was not removing fat by a curette or a sharp instrument, but he believed that the fat has to be treated gently. So he injected fluid into the fatty deposit and making it more liquid and softer. And also there was adrenaline or a vasoconstrictor agent which helped to reduce the bleeding. And the cannula was used to move to and fro into the fatty pocket through that small incision, thereby making it liquid. And this was then connected to a machine which used to suck out the fat. So this is basically how the liposuction evolved, and so the fat is made basically softer and liquefied by injecting a liquid which contains adrenaline and also a local anesthetic, especially if it's being done under local. It can also be done under general anesthesia or under sedation, and this liquid fat can be connected to an aspirator and it is collected in a jar. Even though the original terminology is called liposuction, I think the correct terminology would be liposculpture, because we are not just removing fat, but we are contouring the areas. So it is a type of sculpturing. And also sometimes, and more often than not, there could be areas which require filling. So it's a combination of suctioning and filling. So liposculpture would probably be a better word to describe this. A point of caution: this is not a treatment for obesity. So many times people get confused, thinking that by removing fat they can become thinner and they can lose a lot of weight, and also their cholesterol levels will be absolutely low. So these are all misconceptions. It can be an adjuvant to contouring and losing weight, but it is not primarily a treatment for obesity. When I mean obesity, somebody is challenging to lose about 30 or 40 kilograms of weight. They are in the obese category or morbidly obese category. Then they are probably better candidates for a procedure called bariatric surgery rather than going through lipo, because liposuction has got certain limitations. It's not that you can remove 15-20 kilos safely, and so there are some safety guidelines. And more importantly, if the amount of weight loss is much more than what is targeted by the lipo, it would still mean that the patient has to undergo a fair amount of weight loss by diet and exercise. So if they are not capable of doing this, then bariatric surgery would definitely be the option. So if you would ask what would be the correct indication, the correct indication would therefore be correction of localized fatty deposits or also called figure faults. Now, what we mean by that is there are many times women who are otherwise having a probably ideal weight, or they could be just maybe 3 to 5 kgs more, but there may be abnormal fatty deposits, maybe in the buttock area or in the saddlebags area or in the hip area or the abdomen. So their upper torso may be absolutely normal, but their lower half of the body may be oversized. These people, no matter what they do, if they try diet and exercise, unfortunately weight loss does not happen, or change in the size does not happen in the areas where they want to, but it happens even in areas where they don't want to lose fat. Hence, these patients would be ideal indications for a liposuction. Of course, if they continue with the diet and exercise after the surgery, it's even better. Now, with regard to the instrumentations, lots of changes have taken place in the evolution of instruments, right from the large size cannulas which were used when the process started, to finally making it to very small and thin cannulas with very small diameter, from sharp curettes to blunt cannulas, and also in terms of the suction equipment, from syringes to regular high power aspirators. And all these equipments are basically to improve accuracy, to reduce surgeon fatigue, and also to improve skin retraction. So you have conventional liposuction, there is syringe liposuction, there is laser assisted, there is power assisted lipo, there is laser assisted lipo. So many terminologies are there, but the most important thing is the person who is handling the machine. So good results and even very good results can be obtained by the simplest of instruments, whereas catastrophes can be seen in people who are not used to using the sophisticated equipments that are being marketed. So one must understand about these qualities of the surgeon more than what equipment is being used. Which are the common areas that we can address? As I mentioned, some of the common areas are saddlebags, or we also call it as the trochanteric area, and also the buttock, hip, abdomen, arms, even double chin can be addressed. If you extend the indications, then we even use it commonly in correction of male chest deformity, or also called gynecomastia, about which I had spoken to you probably a couple of weeks earlier. And we also use it as an adjuvant in breast reduction surgery, and along with the excisional procedure. And so, as I discussed with you, it is just not removal of fat, but we also call it sculpturing, because we refill or recycle the fat into areas which require it. So this could either be a depression above an area which it requires to be removed, or it could be, for example, in an area where some tissue has been removed and following the surgery there is a depressed scar, we can use fat to fill it. Fat can also be used to improve the skin quality in various forms. They are called nano fat injections. They can help to improve or modulate scars by injecting into the scar itself. Or we could use it to increase volume. For example, if a face has got a sunken cheek, or if there is any deformity by birth where the cheek is sunken, or sometimes we increase breast volume by filling fat, or in some women where the buttocks are flat, or in men too, this fat can be removed from other area and re-injected, and this is typically called a Brazilian butt lift. So liposuction has gone beyond the actual terminology, and it is now used more or less as a sculpturing and contouring procedure and not just debulking. Now beyond this, again we have what is called high definition lipo, and here what we mean is we are not just removing fat, but we are trying to produce certain skin engravings, or what we call as etchings. This is typically done for the chest area in the males to give it a masculine definition, or sometimes when people want a six-pack in the abdomen, we also do high definition lipo. So these are the various indications where liposuction or liposculpturing is done, and typically it's a procedure which is a daycare surgery. The most important thing is the marking. So the surgeon has to take pictures and mark the areas where we are going to do the lipo. We also need to mark the areas which may need filling, and anything else that needs to be addressed, because when the patient is standing, the deformity is different. Once the patient is lying down, the deformity changes. So it's very important for the surgeon to know exactly where the problems are, mark them and take pictures so that these can be checked during the surgery. It is usually done under general anesthesia. As I mentioned, it can be done for small areas under local or sedation. Typically, it may take anywhere between 2 and 4 hours, and the incisions are very small, maybe about 3 to 5 millimeters, through which the cannula is introduced and the fluid is injected first, and then the fat is sucked out, and thereafter the ports are closed with a couple of stitches. Some people may even leave it open, and after that we put a tight dressing, and the patient is ambulant and discharged by evening. By second day, if we have used plasters or compression plasters, then these are removed, and then the patient is advised to wear a compression garment. And by seventh day, 1 or 2 stitches which have been put are removed, and we advise the patients to wear garments for about 6 weeks to 3 months, which is the actual time it takes for the results to be permanently seen. Diet and advice are usually advised because exercise is advised because it is necessary to maintain fitness. We should not say that I will do the lipo and then I will lead a bad lifestyle. So it's important for the surgeon to guide the patient into good lifestyle and good habits. Every surgery has got complications and possible risks, so this can be kept to a minimum with experience and good surgical techniques. Infection, bleeding, contour deformities, unevenness, pigmentation, and very rarely some fatalities have been reported, but I would say more often than not most patients benefit from this type of a surgery. Here I would like to show you some examples of procedures which have been done, and these are typically the instruments that are used. And here you can see this is the suction machine connected to the cannula, and this is how the fat actually comes out. Most people will think fat as something solid, but because the liquid has been injected to make it soft, it comes out in this format, and you will see that there is very little blood, and what you see at the bottom is mostly the saline which has been injected. This is one example of the newer machines. This is a power assisted machine where the cannula vibrates inside, and here are some examples of women who have undergone this type of a surgery. This is for the abdomen. You can see the quantity of fat has been reduced, and even the waistline seems to be having a better definition, as you can see in this patient. This is more often what we see where patients come for ugly fat deposits, as we call it, in all these areas including the buttock, and this is after the surgery. Here also you can see that multiple areas have been addressed, and there is a better proportion, and even the prominence of the buttock is more here. It has been more homogenized. Similarly, in this patient also you can see. Now here is another patient wherein I have done 2 procedures. One is lipo for this area, that is the hip area, the buttock and the trochanter, and also I have done a tummy tuck. So the stomach has been addressed by lipo and skin tightening, that is why the scar, but these areas have been addressed by suctioning. So you can see how the contour has been completely changed. The very prominent buttock has been reduced by liposuction, and the tummy has been corrected by a tummy tuck. So usually we call these as 360-degree procedures or lipo. The entire circumference of the abdomen and the back has to be done. This is another patient where these marked areas, as I told you, these are the markings which we do to address. And here I marked a grid for this patient. This patient wanted buttock enhancement and not reduction. So these are the marks from the lipo. You can see very small 5 mm marks over here, and the result is better appreciated in this picture, where you can see the contour is better, the buttock is a little more prominent, and the front area, of course, in her case also I have addressed it by a tummy tuck. So I have combined liposuction as well as lipoabdominoplasty, and it gives an overall improvement. You can see how the posture of the patient has changed, and this contour is more, the buttock has been enhanced by fat filling. This is a Brazilian butt lift for the back. Now here again is another patient where excess fatty deposit here and low volume of the buttock. So similarly over here I've removed the fat, and you can see over here the projection is less and here the projection is more because of fat. Similarly in this patient here again, redistribution of fat from these areas to the butt. Now another area which commonly people ask for is the cheek area. So here again, despite the fact that the patient is well and healthy, some of them have problems where the cheeks look very much sunken and they sometimes look as if they are emaciated. So this is a patient where fat has been used to enhance. Of course, there is some loss of volume. The fat does not stay in its entirety. So we may overcorrect a little bit and then wait for 3 to 6 months to see how it is, and if need be, we might do a second correction. Similarly, in this patient too, you can see very hollow cheeks, and this is after the fat has been injected. We also use it for the breast. Some women would not prefer implants, so we use fat to inject into the breast, so that way we are minimizing the cuts and also any possible complication that can be there with the use of implants. Here you can see I've done two sittings about 6 months apart. So this is the before surgery picture, this is after one surgery, and this after the second surgery. So you can see that these patients not only lose fat in some area, but instead of throwing away the fat, we are recycling it. Now I told you about high definition lipo. This is a patient who was otherwise fit and healthy with very little definition of the abdominal muscles, but otherwise he was good. So here we have actually done the etching. So we have defined the rectus. You must understand that what you're seeing over here is not the muscle, but is actually the fat, which is made to look like the rectus muscle, and we have also made the midline and the pararectal engravings to make it look as if the person has a good six-pack body. Now again, similarly over here, I have done the chest area for gynecomastia, and you can see how the chest looks basically by not only defining the chest muscle but also removing the gland and fat. So I think this kind of summarizes where all we can use lipo. It is not just removal of fat, but it is basically a tool which every plastic surgeon uses in a majority of procedures, and not in isolation, but it is something which is used on a day-to-day basis to correct various type of problems. I hope I have addressed most of your concerns, and if there is any other question that I need to answer, you may please ask me. I'll be very happy. Thank you so much.
Thank you, doctor. We have a few questions from our viewers. I hope you have addressed it, that it can be surgery can be done in both women and men. So, and the next question: are the results permanent?
Yeah, with regard to women and men, I think the commonest indication will be for women, and in men it will be usually for the male chest and maybe sometimes for hip deposits. If you ask, the major indications could be in women. Can you repeat the other question?
Are the results are permanent?
Yeah, if you say results are permanent, the fat that is removed is more or less removed forever. There is some amount of fat. For example, if you have about 100 cells in that particular area, and if I have removed about 40 or 50, about 50 of them remain. Now, that means the starting point, if the bulge was so much, it is now reduced. If the person continues to eat and does not do any exercise, then the starting point, which is instead of here, it has come here, it will start building up from here. But it will be a gradual build up, not like starting from here and becoming bigger. So initially, the other areas you will put on weight, but not so much over here. That is the common thing that we find. But if you put on, say, 20 kgs weight or 30 kgs weight, even this area will show some increase in size. So I would say that you cannot say that by doing lipo I will never put on weight. You have to be careful. So that is why the surgeon should also insist that patients understand change in lifestyle and probably I may even go one step further, that before undergoing the surgery we must make sure that they are already following this before they embark on this surgery.
Okay. Thank you, doctor. The next question, is it there any contraindication for this surgery?
Yeah, I would say one of the things, as I told you, if it's gross obesity, then I would say this is not an indication for this. Probably a bariatric surgery will give a better result. If the skin is very loose, if there are a lot of stretch marks, then the quality of results is going to be very poor. Sometimes, and especially in men, they may come with a protruding belly, and they will think that this entire thing is fat. Unfortunately, most of these patients, especially male patients who come with a prominent belly, their fat is not subcutaneous. You must realize that the fat which is being removed is the one which is between the skin and the muscle. If the muscle itself is loose, or if there is fat deposit behind the muscle, these two things cannot be addressed by lipo. So typically that would also be a contraindication. Of course, poor health, if the patient has associated medical problems, then they may not be good candidates for the surgery. If the patient has had previous abdominal surgery and you are going to do a lipo of the abdomen, you must be careful, because you must make sure that there is no hernia and there are no such issues, because if liposuction is a blind procedure, so we should make sure that we do not enter wrong cavities.
Okay. Thank you very much, doctor, for answering all the questions. Hope it will be useful for our viewers also. Thank you very much, doctor.
Thank you so much. Thank you.